Breaking news, California Governor Gavin Newsom signs a bill that advances government-run healthcare in California. We'll tell you what bill he just signed, why government-run healthcare would be a disaster, how much it would cost you, and how we're leading the fight to stop it. I'm Carl DeMaio, chairman of Reform California, and Governor Gavin Newsom tries to present himself as a moderate, but this guy is a big-time far-left liberal. He wants to grow the size and scope of government in ways that we cannot even possibly imagine. He is one of the main proponents for universal health care, for government single-payer health care, where private insurance would be banned and you would be forced into the government healthcare system. Remember, when they talk about socialized medicine, when they talk about government-run healthcare, what they mean is that the private insurance market would be banned. You would be forced to take the government healthcare because in order to fund government-run healthcare, everyone's taxes would have to go up substantially. And so the argument that the government run healthcare advocates give us is that people would save money if they didn't have to pay for insurance. Yeah. Government promising that you're going to save money if they take over a service, please. Absolute insanity. For anyone who believes that, you're a sucker. And so we've got in California this movement more than any other state in the nation for government-run healthcare, and now it's taking a monumental step forward. Here is the story, today's story. Gavin Newsom signs bill that may resurrect pledge on single-payer healthcare. And Cal Matters is a liberal blog, so they kind of soften what's really going on here. We're talking about Senate Bill 770. And Cal Matters starts out giving a little bit of an update on what single-payer healthcare or government-run healthcare really would entail. And they quote Governor Gavin Newsom as a candidate for governor in 2018, saying, quote, "I'm tired of politicians saying they support single payer, but that it's too soon, too expensive, or someone else's problem." In other words, Gavin Newsom is full tilt 100% behind this idea. But some of the far left activists are upset with him because they don't think that he's moved fast enough. A number of bills have been introduced in the state legislature in the past several years to go full bore to single-payer healthcare, government-run healthcare in California. It would impose a massive tax system, ban private insurance, have government take over, and ration healthcare to all of us. We'd be at their whim and their mandate. By the way, that means healthcare freedom would be gone. You thought COVID-19 was difficult to get freedom of control over your medical care. Wait till government bans any private practice providers out there and says, no, you will take our health care and that's all. And we will determine what you get, when you get it, how you get it. And we will force you to take a vaccine or other treatment in exchange for us providing you any additional services. You mark my word. You even had Assemblymember Lorena Gonzalez during COVID-19 say that the most disgraceful, despicable, inhumane thing, saying that people without masks shouldn't be allowed ER care or ventilators. Despicable. Absolutely insane. Newsom has so far not gone full bore in the government-run healthcare space. He says, quote, this is in 2022, "I think that the ideal system is a single-payer system. I've been consistent with that for well over a decade. The difference is here is when you are in the position of responsibility, you got to apply, you got to manifest the ideal. This is hard work. It's one thing to say, it's another to do. And with respect, there are many different pathways to achieve the goal of, again, no private insurance, no private practice providers for healthcare, no choice by consumers, a complete government takeover." Now, California is as close as you can get right now already to government-run healthcare in that we've got basically one of the most generous welfare systems in the country. Our Obamacare exchange covered California is the most generous of any in the country. There's all sorts of mandates on small businesses for coverage. And on top of that, we provide free taxpayer-funded healthcare for illegal immigrants. You are on the hook for their medical bills. Now, a single payer system would cost about $450 billion to $500 billion, $500 billion, according to government estimates. So you can probably add at least 50% premium on top of that because the government estimates are always off. But Senate Bill 770, what would it actually do? And he actually signed the bill just last week. It orders state officials to begin a negotiation process with the federal government. So he's going to be negotiating with Biden and one of his buddies, Xavier Becerra of the Department of Health and Human Services, who's the Secretary of HHS. Xavier Becerra used to be the Attorney General here in California, so he's thick as thieves with Newsom and the wingnuts that run our state. SB 770 would say that we should start to apply for and receive a waiver from the federal government to divert federal healthcare monies into the state's government-run healthcare system. Because in order for them to try to fund the pipe dream of single-payer government-run healthcare, they're going to have to take three pots of money. They have to take the state taxpayer money, which you're on the hook for. And that's a lot of money for illegal immigrants and all sorts of other procedures and coverage. Second, they would have to take all the federal money. So all you senior citizens out there, suckers, Medicare will be destroyed by the Democrats if they have their way here in California. You would lose your Medicare options and your private provider, and you'd be shoved in the government-run system. And then, of course, you would have the remaining 1/3 come from a tax on you. So remember, your taxes are already paying for the whole thing. So people who think, oh, government-run healthcare is free, no. You're paying your federal taxes for the federal healthcare subsidies. You're paying state taxes for the existing state subsidies. And then, of course, right now, you would be forced not to be able to buy private insurance, private providers. You would be forced to pay directly into the government-run healthcare system in the form of a tax increase. Now, the tax increase that has been developed, it consists of a payroll tax, an income tax, an excise tax. This is pretty crazy, right? So the payroll tax would be levied on all employees. It would basically be a job killer because employers would say, well, it's now more expensive for me to run my business because there's an off-the-top payroll tax that's taken out. You would be paying a higher income tax. That comes out of your paycheck, so you're earning less money. And then, of course, there would be an excise tax on businesses. What's an excise tax? An excise tax is based on gross receipts. So businesses that don't even make money, businesses that don't turn a profit will still be charged this single-payer government-run healthcare tax. This is a jobs killer. It is an inflation booster. And of course, I haven't even gotten into the crappy care that you would get under a government-run system. Just talking about the financials up front. So $500 billion, if not more, and it would be a massive tax increase. It would double the size of the state budget overnight. It would double the size of the state budget overnight just to add in this additional healthcare program. Now, this waiver means that the state of California will have in its hand a waiver from the federal government that basically then creates the leverage to finish the whole deal and just raise taxes on you and the rest of the California tax-paying base. How much would your tax go up by? The estimate is about $16,500 per household. Did you hear that? $16,500 per household per year. Now, I think that is woefully low because you actually aren't factoring in the excise tax, the gross receipts tax, the federal monies, All of these monies actually come out of your tax base, and it will balloon the expenditures of government in our state. There's just no doubt about it. At some point, it comes back and hits you in the form of additional taxes. They will raise your taxes as long as they have bills to pay and programs that they want to follow and pursue. Now, the liberals will say you're going to save money. How do they say you're going to save money? Well, you don't have to pay premiums. Okay, for some of you, $16,500 actually might cancel out your premium, or you might even save a smidge of money. But here's the problem with that theory. Do you really trust that government can run something more efficiently than the market? Do you really think that they're going to be able to save you money? You're a fool if you actually think that that's true. These people are absolute scams. They are absolutely inept and inefficient. The wasteful spending, the payoffs, the special interests, the bureaucracy. No, it's not going to be less expensive. It will be exponentially more expensive. And let me also add this to the mix. Do you trust the same failed state that can't fill potholes, the same failed state that can't actually issue the right unemployment benefits to people on time, and instead issues $30 billion of wasteful, fraudulent unemployment benefits out, such that we are now $20 billion in arrears in debt? And now they're raising the unemployment insurance tax on you. Do you trust that same state that has shown absolute incompetence? How about putting in charge the same state that runs the DMV, putting them in charge of running your cancer screening or your urgent emergency care? Now, this is a absolute disaster waiting to happen. And we have to unite and say absolutely no. It's not affordable, and it's not going to get us the sort of quality care that we deserve in the state of California. The better alternative to improve healthcare access is to drive costs down. There's no mistake about it. But these are liberal politicians who've increased the cost of everything. Everything they touch, everything they look at comes with a mandate, tax, levy, or fee. I hope that you will join us in stopping this absolutely reckless proposal, which is why our voter guide at Reform California is all the more important in this election, to make sure that we oppose candidates that want government-run healthcare, that want to raise your taxes. So go to the website, reformcalifornia.org, reformcalifornia.org, sign up as a volunteer to get the voter guide. And of course, please chip in a contribution. We are entirely funded by the grassroots, and we need your help to produce news stories like this, to get that voter guide out, to recruit and train and back good candidates for all levels of office, from state assembly and state senate all the way down to school board and water district. We're going to need your help in the fight to restore sanity in California, to prevent the government takeover of our health insurance and health care, which would be a disaster. Check us out at reformcalifornia.org and help us break through the censorship of the liberal media. Please like this video right now and share it with your friends. Also, keep in touch by subscribing to this channel so you get our daily updates on news and politics in California. Until next time, Carl DeMaio, Chairman of Reform California. Thanks for watching. Help us break through the censorship of the liberal media by liking this video, sharing it with your friends, and subscribe to my YouTube channel.